Hi, welcome to Puriva Clinic. Today, I'm going to explain about filler and how this has become everyone's favorite. Filler is an injectable treatment using hyaluronic acid that binds with water to form a sticky gel to fill a hollow part of the face to restore the volume and also to give a more youthful appearance. It can also be used to augment a part of the face such as the nose, the lips, and also to give a stronger definitions of the jawline. Depending on the thickness of the product and the concentrations of the hyaluronic acid, it can now last up until 2 years. The latest generations of filler has enhanced characteristics such as easy to mold, not moving with facial expressions, and then no migrations. And in all, this makes the filler treatment has become much more natural looking. How we are going to conduct this injecting treatment, let's see here in this video. Hi Happy, how are you?
I'm good.
Good. Okay, are you ready?
Oh yeah.
Okay, perfect. After a thorough consultations, we will prepare the patients for filler treatment. Our nurse will clean your face from makeup and dust and will put local anesthetic cream if needed. If anesthetic is applied, we will have to wait for at least 30 minutes before injections to let the cream take effect. After that, we will clean the face from the anesthetic cream and apply antiseptic before the doctor starts the injections process. There are two methods to inject the fillers, either by using a sharp needle or sometimes a blunt cannula is used, depending on the type of fillers and the injection site. After finishing the injections, the doctors usually will do a gentle massage to avoid any lumps on the area treated, and antibiotic ointment will be applied as needed.